Okay, this is a quick neuromuscular pathophysiology review. To study for the exam, it does help to place this information side by side in order to view the differences. In multiple sclerosis, the body mistakenly directs antibodies and white blood cells against proteins in the myelin sheath. The myelin sheath is a fatty substance that insulates the nerve fibers in the brain and spinal cord. When the antibodies and white blood cells attack the myelin sheath, it results in inflammation and injury to the sheath and ultimately to the nerve that it surrounds. And this results in multiple areas of scarring, which is the sclerosis. Eventually, this damage can slow or block the nerve signals that control muscle coordination, strength, sensation, and vision. Multiple sclerosis is a degeneration of the myelin sheath surrounding nerves in the brain and spinal cord. What is cool about myelin is that it can regenerate and symptoms disappear, resulting in a remission. What is not cool is that it can be replaced by scar tissue, and then the impulses slow down, and that results in a permanent loss of new function. In multiple sclerosis, those monocytes and T cells attack the myelin. I kind of think of Darth Vader's Death Star, attacking the myelin road to the nerve cell. So basically, multiple sclerosis is just a chronic, progressive, degenerative disorder of the central nervous system and is characterized by disseminated demyelination of nerve fibers of the brain and spinal cord. This is a chronic, debilitating disease that affects the central nervous system, and it is widely believed to be an autoimmune disease and one of the leading causes of neurologic disability in people 20 to 40 years of age. Multiple sclerosis is characterized by the inflammatory response that results in random or patchy areas of plaque in the white matter of the central nervous system. When this occurs, the myelin sheath is damaged and its thickness is reduced. Myelin is responsible for that electrochemical transmission of impulses between the brain and spinal cord and the rest of the body. Impulses are still transmitted, but they're not as effective as before, and over time they may be completely blocked. The pathological process of Parkinson's disease involves degeneration of dopamine-producing neurons in the substantia nigra of the midbrain. Acetylcholine-producing neurons transmit excitatory messages throughout the basal ganglia. Dopamine inhibits the functions of these neurons, allowing control over voluntary movement. So when dopamine levels are decreased, a person loses the ability to refine voluntary movement. A large number of excitatory acetylcholine-secreting neurons remain active, which creates an imbalance between excitatory and inhibitory neuronal activity. The result is excessive excitation of neurons prevents a person from controlling or initiating voluntary movement. Parkinson's disease gradually often starts with a barely noticeable tremor in just one hand. But while tremor may be the most well-known sign of Parkinson's disease, it also commonly causes a slowing or freezing of movement. Diabetes increases with age, with peak onset being in the 6th decade. More common in men, and the onset is gradual and insidious. The classic triad is tremor, rigidity, bradykinesia. Beginning stages may involve only mild tremor, slight limp, or decreased arm swing. Later stages have shuffling, propulsive gait with arms flexed, and loss of postural reflexes. Myasthenia gravis is a chronic disease characterized by weakness and rapid fatigue of the voluntary muscles. The weakness is due to a breakdown in communication between nerve ending and its adjoining muscle fiber. The onset of myasthenia gravis can be sudden with severe and generalized muscle weakness, but more often its symptoms in the early stage are subtle and variable, making it difficult to diagnose correctly. Myasthenia gravis affects people of all ages and either sex, but it affects more young women and old men. Myasthenia gravis is considered an autoimmune disease that gradually causes muscles to lose their strength and function. And autoimmune diseases are caused by the body making substances called antibodies that attack a person's own tissue. In myasthenia gravis, these antibodies are made against receptors in the neuromuscular junction, the area where nerve transmission makes a muscle do its work. Acetylcholine is the neurotransmitter that is involved in the transfer of information to muscle tissue. In myasthenia gravis, cells that bind to other cells to neutralize or destroy them, the antibodies, destroy acetylcholine receptor sites in areas of the muscle tissue that receive the nerve impulses, which prevents the nerve impulses from reaching the muscle. This results in weakness and rapid fatigue in the affected muscles. ALS is a progressive neuromuscular disease that weakens and eventually destroys motor neurons, the components of the nervous system that connect the brain with the skeletal muscles. Upper motor neurons are located in the cerebral cortex of the brain and conduct impulses from the motor cortex to nerves in the brain or the spinal cord. Lower motor neurons are peripheral neurons that originate in the spinal cord and conduct impulses to the skeletal muscle. Skeletal muscles are involved with voluntary movements such as walking and talking. The lower motor neurons transmit the command to move from the brain to the skeletal muscle, which responds by contracting. Other possible causes include free radicals. The inherited form of ALS often involves a mutation in a gene responsible for producing a strong antioxidant enzyme that protects your cells from damage caused by free radicals, which is the byproduct of oxygen metabolism. Glutamate. People who have ALS typically have higher than normal levels of glutamate, a chemical messenger in the brain, in their spinal fluid. Too much glutamate is known to be toxic to some nerve cells. Autoimmune responses. Sometimes their immune system begins attacking their own normal cells, and it's speculated that antibodies may trigger the process that result in ALS. Looking at this picture, normally the muscle tissue is supplied by the nerve. It all happens in the muscle fiber and produces an action potential, allowing the muscle to contract. In ALS, the motor nerve cells in the anterior horns of the spinal cord and in the motor nuclei of the brainstem are lost, affecting the innervation of the muscle. Huntington's disease is a progressive degenerative disease that causes certain nerve cells in the brain to waste away. As a result, the person may experience uncontrolled movements, emotional disturbance, and mental deterioration. Huntington's disease is caused by the destruction of nerve cells located in the basal ganglia and cortex area of the brain. The basal ganglia control motor movements. The cortex underlies intellectual characteristics such as thinking, decision-making, and memory. Huntington's disease is an inherited disease. Signs and symptoms usually develop in middle age. Younger people with Huntington's disease often have a more severe case, and their symptoms may progress more quickly. Rarely, though, children may develop Huntington's disease. Alzheimer's disease develops when there are clusters of insoluble plaques, the B amyloid or other proteins, which are remnants of neurons and non-nerve cells. Neurofibrillary tangles, which are abnormal collection of twisted protein threads inside the nerve cells. The main component is a protein called tau. The plaques develop in the parts of the brain used for memory, such as the hippocampus. Eventually, it will go to the cerebral cortex. The tau proteins provide support for intracellular structure. They hold microtubules together as like railroad ties hold railroad tracks together. The tau proteins, though, can alter in Alzheimer's disease, where the microtubules twist together in a helical fashion that form neurofibrillary tangles. This will result in gradual loss of connection between the neurons and leads to damage and then death of the neurons. Affected parts of the brain begin to shrink. We see brain atrophy, which is very significant in the final stages of Alzheimer's disease. This is a comparison of the normal brain on the left and the brain of an Alzheimer's disease patient.